సైన్ ఆఫ్ అయిపోయింది.
అంటే ఇప్పుడు ఓకే పర్వాలేదు, బట్ ఒకసారి స్టార్ట్ అయిపోయిన తర్వాత బాగా డిస్టర్బెన్స్ అయిపోతే చాలా కష్టమైద్దేమో. ఎప్పుడు కాలేదు కదా ఇంతవరకు?
కాలేదు మరి, ఇప్పుడు అయింది. నేను ఐ డోంట్ నో.
2 సార్లు అయింది.
yes I don't know. yeah, now it's okay. I think ఇప్పుడు live also it started.
okay.
Hope it works this time.
Yeah.
Good evening, Dr. Surya Prakash Rao garu.
అవునండి. Hope it works this time.
Morning, Ganesh. How are you?
Good. How are you?
Good, thanks. I think, when I saw you, I have a feeling that, I met you at campus. Like, I came to your lab when you were in Davidson's lab.
Oh, I see.
Because I remember now.
Mm-hmm. Well, this Zoom, I think there are options. I don't know what options they licensed it. Sometimes it won't give you enough time. Sometimes it will give you trouble. These days, anyway, Zoom is really giving trouble for others too.
Today, I got this advertisement on my computer stating that we are using cookies and we will monitor you. We will, that kind of thing has appeared on my screen for the first time. Normally, such things was not, appearing, but this time it appeared. So I was thinking maybe Zoom is trying to do.
Yeah.
I think it happened last week too, I guess.
Yeah. Well, until everyone joins, really, I appreciate how much you really educated everyone, Dr. Mahendra, about the COVID as well as in terms of precautions to take, or in terms of deal with it, live with it, and ride with it. I really appreciate it. How many seminars you have given, where you have given, whether it is virtual or in person, doesn't matter. But I really appreciate the work you have done so far. Yeah.
Thank you so much. It's my pleasure.
Very important. It was very important. Someone has to do it. Yeah.
Thank you so much.
So you are based in Massachusetts?
I'm in Boston.
Boston.
Right between MIT and Harvard.
Mm-hmm. Yeah, I was there one time in 2008 to give a seminar in a small company. Well, it may be a big company now, RQ. And then I came a couple of times for a ACS meeting back then, but recently haven't been there.
I see.
Dr. Vijaya, you are there, no?
Yes, ma'am.
Yeah. Shall we start, Dr. Madhvi?
Yeah, let's go ahead and start with Mystery. Yeah.
Start. Some more will join. Okay. Yeah. So I forgot to give this link to everyone. Good evening, everyone. All the mentors, the scholars of Department of Chemistry, MSc students, and my dear colleague, faculty members. Welcome you all to the next in the series of the Step Up Mentoring Program. This is the 9th one in the series. May I welcome Dr. Vijaya Charan, who is the in charge of the Inorganic Chemistry section of Department of Chemistry, to give a formal welcome address. Dr. Vijaya Charan.
Yes, ma'am. Thank you,
Madam.
Padmashri, madam. Yeah, am I audible?
Yes. Please go on. Once I'll mute everyone, I think.
Yeah, ma'am.
First, then you can, a lot of disturbance. Yeah, Dr. Vijaya, please unmute yourself and carry on.
Am I audible, ma'am? Am I audible?
Yes.
Padmashri, madam?
Yes,
Yeah.
Dr.
Yes.
Vijaya.
Please carry on.
Yeah. A very warm welcome to Professor Umesh Kumar. I don't know, sir is there in the meeting. Head Department of Chemistry. Dr. Ravi Prakash Mereddy, sir. Dr. Madhavi Shrikoti. Dr. Mahinder Deval. And today's mentor speaker, Dr. Tota Ganesh. Other mentors of OU alumni, dear colleagues and research scholars. With great honor and pleasure, I welcome you all on behalf of the Department of Chemistry for the Step Up Mentoring Program 9, which is organized by the Department of Chemistry in association with Alumni Mentors Group, Usmania University. As a part of this continuous step up mentoring program, so far we have completed 8 mentoring programs where we came across with eminent mentor speakers who shared their personal and professional experience, knowledge, and guided our scholars on academic goals. I feel it is a very good platform and opportunity for the scholars to interact with the mentors and take their valuable suggestions. So I request the scholars to utilize this opportunity and get benefited by these lectures. On a final note, lastly, I would like to take this opportunity to express my gratitude to our OU alumni mentors for taking their time out of their busy schedule and for their tremendous support to the scholars. With this, thank you one and all. Over to Padmashri ma'am.
Yeah, thank you very much, Dr. Vijaya, for the wonderful welcome note. Now, may I ask Dr. Madhvi to take up and take forward the session, please?
Yeah, thank you, Dr. Padmashri, and thank you, Dr. Vijaya, for that warm welcome. And I'm Madhavi Shrikoti. I would like to invite Dr. Tota Ganesh, who has obtained his master's and PhD in organic chemistry from Usmania University, and he did his postdoctoral studies in IIT Bombay and University Durham and Virginia Tech. He is now working as an associate professor at Emory University School of Medicine, Atlanta, Georgia. And Some of his research interests are to study biochemical, molecular, and pathological phenotypes in the brain and lung disorders, and develop medicines for treating epilepsy and Alzheimer's disease and infections caused by viruses and pandemic potential, such as what we are seeing in past 1.5 years. So with that, I would like to welcome Dr. Ganesh Tota.
Thank you, Dr. Madhavi. Yeah, I can hear you. Thank you, Dr. Madhavi, for your kind introduction. I really thank the visionaries of this program, alumni, OU Alumni Association members, Dr. Ravi, Prakash, and Dr. Sudhakar, Dr. Bhaskar here, and other members of the Alumni Association to putting together this wonderful program. Also, Dr. Padma Sri, Dr. Professor Vijay Charan, and all who participating in this and getting this moving forward. And also, one more time, good morning to my friends in the US and good evening to doctors, professors, and students in India. Hope head of the department, Professor Umesh Kumar, is on the line. Good evening to him as well, and his co-faculty. So it's my pleasure that to connect with you and we students and share some of my experiences and my exposure to the research and beyond. If we can share some thoughts for the students, I would be very, very pleased to do that one. So with that, I would like to.
You can please share your screen.
Yeah. Are you able to see the presenter mode or only one slide? Okay.
Yeah. It's not in slideshow. No.
It's not in slideshow. Okay.
No, it's not. Yeah, that's great to see Professor David, sir.
Okay. So obviously, thank you. So I started my obviously research career with Professor David Krupadanam. I was working on developing some synthetic methodologies. At the time, we also had this natural product discovery. We were really pleased to have that experience going to our beloved Srisailam forest and take a botanist and then a tribal person to get some selection on the plants, get the materials, and then extract those plants and then get the structural elucidation of the novel compound. Then, just until my degree was up for a defense and an evaluation, I went to IIT Mumbai. I worked with Samsura Kota, I will show you in a second, where I also worked in the synthetic methodologies and for a natural amino acids and some polyquinates. As soon as I got the degree, then I moved to England, worked with Patrick Steele and synthetic methodologies of bioactive compounds. Then postdoctoral scientist, I came back to US in 2002. I worked with David Kingston at Virginia Tech. Then, after 4 years of training there, and I came to Emory University. Worked with Dennis Leotype. Some of you know, this is one of those professors who made a difference to the world, who created the medicines for AIDS and HIV-related infections. Then I think from chemistry department I moved to a pharmacology department now as a faculty member since 2011. So kind of during the process, I kind of transitioned from pure organic chemistry to some and medicinal chemistry, transition to medicinal chemistry in Virginia Tech, then medicinal chemistry in Dennis Leotype lab, now a little bit seasoned with neuroscience and neuropharmacology area. So I will just for today save some time. I'll skip what I have done during the PhD, but in IIT Mumbai, when we went there, there was a huge interest and then I would say passionation on synthesis of some of these challenging molecules, such as the platonic solids. I have shown one of them here is dodecahedron. Professor Samsura Kota He was the student of Govardhan Mehta. Mehta himself had a passion to develop methodologies for these, and then Kota himself. So if you look at these molecules, it's the first successful I have done was in research wise, at least when I moved to IIT Mumbai, nobody know how to draw this molecule on computer. Forget about making in the lab. So I was able to make it because the computers were just coming up in India. Obviously, it was not even a drawing was possible in 3D mode. So I have made that in screen first. Then there was so many people tried to synthesize this molecule using various intermediates. For example, here is one pagodan trying to make people from there to here. And then there was this, Woodward, he was trying to connect these two triquinosyns to make this molecule. There are so many approaches were there. So we were also trying to develop a new approach for this. In fact, our approach was starting from this Cox dione, just with simple alkylation and lactonization. Do the same thing again, you get this C20 carbon containing molecule, and it adopts such a conformation. Then we can make bonds between these ketone, and then this, and this. So we were so fascinated. If you look at this molecule, has C20H20 hydrocarbon, 12 5-member rings, 20 identical methane units with 30 CC bonds and 36 ring junctions. If some of you still enjoying the organic chemistry, professors, it has icosahedron symmetry. So all made us to, in fact, there were some biological applications as well. So made us to work towards this. So at that time, I'm sure now you probably adopted into teaching classes now. Metathesis was really coming up. It could be a E9 metathesis. It could be a simple ring closing metathesis. It should be in textbooks now. What does it mean is that if you have two olefins, if it is simple, with double bond, you get a single double bond. Or if you have one ion, one in, you get the di like this. So Kota sir was one among those pioneers at that time in metathesis. We were the first to buy this catalyst from US. We have done a lot of methodologies. What we have done in here in the left side, I can show you here. We in one step we have made this diene using the Grubbs catalyst mediated enine metathesis, and then do the Diels-Alder, and then you get this unnatural amino acids. Same thing here. We developed another methodology to synthesize unnatural amino acids. Natural amino acids are there everywhere in DNA, RNA. You have those properties, but if you built the unnatural amino acids into, we can really modify and then modulate their peptidomimetics and then their biological properties. That was the goal. But anyway, some of you might know there were so many catalysts after catalysts developed from within the Grubbs catalyst area. There was this gentleman, Professor Schrock, Chavin. They together actually went on to win the Nobel Prize. I had to remind the students that when when Grubbs was really inventing this catalyst, he was a metallic chemist, or he was an inorganic chemist, I would say. But the catalyst he developed finds so much applications in organic chemistry. That's what actually, led these three people to, win the Nobel Prize on this. So I think from there, when I was in Professor Kota's lab, in fact, I did apply for an RA fellowship at the time. I began actually back then writing the grants on my own and then making the presentations with new ideas to the group first, and then new ideas to the CSIR and other areas, and then get some funding. So before even I completed my RA position there, when I awarded a PhD, I went to University of Durham, UK, where we had some interest to develop methodologies as well as interest to develop methods for biologically active molecule. So we were trying to develop a method for this rizoxamycin, which has some antibiotic activities. There was no method, obviously. We envisioned that a method can be developed very simple. This can be retrosynthetically cleaved to this, and this can be generated from this, and then this can be synthesized from this. So in fact, we did synthesize, develop a method for this. And after that, we had a challenge to solve. Obviously, when you have an amine, a chiral amine, an enantiomeric amine, it's a textbook chemistry. First thing you would try to do the optical resolution by any chiral carboxylic acids or chiral amines, optical resolution. Somehow it didn't work. Then we tried to derivatize with chiral compounds, like in a typical diastereomer synthesis, which can be separated by column. Didn't work. Then I had this experience working in Professor David Sar's lab. I didn't show you today. In fact, I was the first person who, in David Sar's lab, I went all the way to our old city slaughterhouse, our Hyderabad old city slaughterhouse somewhere near Charminar, and they get the fresh bovine liver. Bovine means this govulu ఉంటుంది కదా అక్కడ అవి ఆ గోవుల నుంచి వచ్చేటువంటి fresh liver. I used to get it and then homogenize it and then extract the livers. Same thing we used to do from the pigs. So I had that experience of isolation and using the enzymatic work, resolution work. So I applied that in Taxol's laboratory, and I was able to get the resolution of these enantiomers. So since that, I think once we have that done, and then obviously we went on synthesizing this, finally we ended up the molecule that we want, that was published in there. I just wanted to close this with once we have this molecule, the optical resolution doesn't match to the published molecule. We have taken all the controls we wanted to do. Then we asked why. Then there was a literature showing that there were some anthralinate intermediates in there. And then we thought that potentially the reported structure was something close to this, not exactly this. In fact, we corrected the structure of the published work and then presented it. It works, sometimes you think something is there. We always believe that it is correct, but it may not be correct. So we had to revise the structure. So then when I was in Patrick Steele's lab, I applied for a fellowship. In fact, I wrote a proposal to Canadian government and applied for a fellowship. In fact, I did get a fellowship. Unfortunately, that was the September 11, 2000 time when things happened in US. I couldn't come in time to the US, but slowly, I decided not to go into Canada and then came to US. I came to Virginia Tech with this senior professor, David Kingston. Some of you might know, he's a natural product chemist, as well as a pioneer in Taxol. So some of you might know about the Taxol story. Probably Dr. Madhavi might know more because it's a BMS molecule. Most celebrated molecule of a natural product all times. First approved by the FDA in 1992, became world's best-selling anti-cancer drug with sales over 1 billion in 2001. So its activities, against various cancers, including ovarian, breast, lung, non-small cell cancers, AIDS-related Kaposi sarcomas. So it comes from this Taxus brevifolia plant. It's known as a Pacific yew tree. So it was actually comes from this bark about 12 kilograms of stem gives only 0.5 grams of Taxol, which is 0.04% yield. So to really treat the patients, you can imagine how much tons of bark we needed. In fact, there was a project at that time to cultivate these plants and grow the forest and then get it. It's not going to happen. Logistical reasons actually it was given up. But thanks to Bob Halton, who actually synthesized this molecule in a semi-synthetic fashion, starting from this intermediate called baccatin, derivative. And then where that come from? A widely growing plant known as Taxus baccata. It's 10 DAB. You get in 1 to 2, 3. You get this and then you
Sorry, Prof.
Thank you. Yeah.
Because of the disturbance.
Yeah. Thank you. So with these semi-synthetic route, in fact, we were synthesizing so many derivatives of Taxol. But what does Taxol do? If some of you would like to know, in biology, if a cell has to divide into 2 cells or daughter cells, it will go through a cycle, interphase where you have this G1 S phase, G2 phase, and it goes to divide into 2 cells. Somewhere in G2 phase, Taxol and another natural product called epathalone, few other molecules bind there and then sends to apoptosis. That's how it kills the cells. So here you can see some of those structures. So what does it do? It binds to a target called tubulin. I will show you in a second. The tubulin is a cytoskeleton element in the cell, which is like a web-like structure. It will maintain the integrity. When time comes, it lets the cell to divide into 2 cells. So if you and the Taxol binds the tubulin and then actually disrupt the cell's integrity as well as that's what happens. If you go a little bit deeper into this tubulin thing, tubulin is always in a dynamics, like a tubulin is made up of alpha and beta tubulin, which will associate into alpha. So this will associate dimerize to form these dimers. Many dimers will form like protofilaments. 13 of such will form a microtubules. So this usually is in dynamics, which is important for cell. But if Taxol binds, then it promotes the polymerization. That's how it sends the cell process. Well, anyway, our goal was not only to make some derivatives of Taxol, but really to understand how this Taxol bind to tubulin. Why? Because if we know, design better molecules, much simpler one that can be synthesized in the lab. So there were various models available for Taxol, such as binding models, I would say, how it to tubulin. Someone was saying this is binds in this conformer. Someone was saying this conformer because they have found this in crystal structure. And there is one person came from Emory. He used a lot of molecular modeling studies and suggested that this might bind in a T-shaped conformation, meaning that one of this C2 benzoate is equidistant from these 2. So we utilized that model, and then Dr. Kingston and me come up with some strategy to lock this conformation, making a bridge between these 2. So we ended up making bridged Taxols. In fact, several of the Taxols I have synthesized myself showed about 20-fold more potency than Taxol. In fact, we acquired a patent on this. Here, what I have done was remarkably that basically you had to synthesize this diene and you had to use the ring closing metathesis to get the olefin. I had a prior experience working in Dr. Kota's lab at IIT Bombay using these catalysts. When my professor was saying that there were 2 people, he came to me, hey, Tota, this reaction won't work because there were 2 people, postdocs, worked on this project before you. They tried all they can do, and it won't work. So he put me on different project. So because I had so much experience and I know how to do this reaction, I just can't give you detail as I can, because I went ahead and tried this reaction using a high dilution technique that we all see somewhere in the hospital setting, how we inject the saline for patients slowly. So that's how I injected the catalyst rather than adding one time and cooking it. So it worked, and it worked for many compounds, not one. So we ended up publishing a paper in PNAS. It was very difficult to imagine a good profile paper for chemists at the time. These days, now we see a lot of chemists publishing in Science also. But because we locked that conformation, we proved that the conformation in solution has increased from anywhere from 6% to 83%. So that was the whole goal. And then we kind of provided experimental evidence for this, tubulin bound conformation. So we wanted to use this information to rationally design simplified molecules. For example, here is the Taxol, bridged Taxol I have shown you in a previous slide. Here is the simplest structures we have designed. See the complexity from Taxol ring to here. That much simplicity we came, and then in fact we synthesized several of these molecules, and we retained some of the tubulin binding inhibition activity. We had several other natural products in our interest at the time to determine the tubulin bound conformation. In fact, I worked on this epothalones, total synthesis, as well as some bridged epothalones to determine the tubulin bound conformation. I don't tell you today because of the time. I need to keep it students to ask questions. But here is one thing, this is a natural product that comes from a soil-derived bacteria. All others also comes from marine sponges, for example, discodermalite, and the eleutherobin comes from corals. These are all natural products. And because of the high toxicity, this molecule couldn't be a drug. There was a professor named Samuel Danishevsky. He's retired probably. He's no longer active. He maneuvered simply changing one oxygen to nitrogen. So it's called ixabepilin, and then BMS acquired the rights to use this molecule for cancer use. So it's a small modification, really helps to optimize the drugs. So I do not need an answer right now for students. If anyone watching clearly these slides, about 50% of the drugs isolated from natural sources are found to be cytotoxic. Think about it, what might be the cost? We'll come back to it. So from Kingston's lab, we have handled several projects. I just couldn't show all the stories there that we did. But when I moved to Emory, we have been focusing on discovering some small molecules to treat brain injuries. Status epilepticus is one of the diseases, and then epilepsy. These are like a sister diseases, one make the other, and then Alzheimer's disease. So because the interest of the time, there is a Cox II enzyme, or Cox II, if some of you might know the story of Cox II. Cox II is an enzyme induced after injury to the brain or even in the periphery. Anywhere if you get injured, Cox II will be induced in the body, which synthesizes the cell-derived arachidonic acid into an intermediate called PGH2. That will be converted into 5 different ligands, prostaglandins we call them. They activate 9 different receptors. So basically, many of these have physiological roles. So we identified one receptor that has inflammatory role. So we could target that receptor to develop therapeutic agents. So that was how we developed, how we selected a target. In fact, this is a slide I use it, in modern drug discovery. You have various steps to discover drugs. First thing, stage one, you will obviously spend several years. Biologists mainly, they identify the targets. Then it comes to chemists, where they try to identify small molecule. Then it comes to, somewhere in the middle of the people, either a biotech, pharma, or medicinal chemistry lab, they did optimization. And then it goes to clinical testing, where various steps are involved in drug discovery. But I cannot really go enough details now. But every step you have challenges to solve. This is how a modern discovery is done. Before 1990s, there is something serendipitous discovery, if some of you are familiar with. Like our what is that? Penicillin was discovered, and like how Viagra was discovered, or Zetia was discovered, all cholesterol lowering drug. That was a phenotypic screening, that you do an experiment, you see something unusual going on, and then you went on to develop it. But here you go after, identify the target first, identify the molecule, then optimize the molecule, then you send it for various stages. Like if you come to preclinical testing, you have to file an IND, then you send it through several stages. First you test in less than 10 patients, volunteers, healthy, then you go to 100, then you go to 1,000, then you file new drug application at that time. But anyway, if a drug has to evolve from this path, it really could cost 2.6 billion, according to an estimate. It's really a challenging endeavor. I'll skip several of these steps, but I will. That's how we came up with, in fact, some of the small molecule. We screened about 262,000 molecules in a high throughput screening assay. And finally, with various selectivity assays, we came up with 1 or 2 molecules here. That's where we built upon. During the optimization, in medicinal chemistry, this is what we have to do, or what we do, or what several laboratories do. For example, assuming that you identified a molecule like this, in fact, we did, TG4155, that's what I named it. You see the obvious sites of reactivity. The reactivity I'm talking about, the reactivity of this molecule in our in vivo systems, such as our body when we give it to our rodent's body, our animal's body. So you slowly decrease the reactivity of the molecules if it has, like one time, in one cycle, we have decreased it by changing CH3 to CF3, and acrylamide to amide, and then trimethoxy to something else. That's how we optimized it. So here is one molecule, TG610-1, that's what we named. Typical pharmacology slide here on the right, you see this molecule dose dependently decrease the EC50 of a natural agonist, and we can measure the shield Kb with 17.8 nanomolar. So this is the molecule. We optimize the pharmacokinetics. Like if you want to treat a molecule to animal or patient, you need to make sure that does it stay in the plasma? Does it get into the brain? So after characterizing all this, I would like to just give you a quick summary on this problem. Status epilepticus is a life-threatening disease, a medical emergency, in fact. Continuous seizures lasting than 30 minutes is known as status epilepticus. I'm sure some of you must have seen some patients seizing. It is associated with a high mortality. In fact, 150,000 new cases are seen in US and 55,000 deaths every year. It's a huge unmet medical problem. There were not many, there are some anticonvulsants available to suppress the seizure, but there are not many, actually there are not any drugs to prevent the subsequent brain damage. Moreover, the status epilepticus, unfortunately, there's another reason it is emerged these days. Back in the days during the World War time, there were these nerve agents that were created to use for military purpose. But unfortunately, these nerve agents, I'll show you in a minute, they landed in terrorist organizations' hands, and then they used on people. There was one time in Tokyo, Japan, subway attack, several people killed, injured, and then there was mass casualties in Syria recently because of exposure to these nerve agents. So what do the nerve agents do? They actually bind and inhibit an enzyme called acetylcholinesterase enzyme that breaks down the neurotransmitter acetylcholine. At the synapses, if some of you know neuroscience, the synapse is a place where your neuron ends meet. And then because it breaks down that enzyme, you build up so much acetylcholine in the junctions. As a result, your neurotransmissions will be disturbed. So you create the crisis that will lead to seizure activity. And in fact, these are so reactive, these nerve agents, they even age the enzyme that, even if you remove those nerve agents, the enzyme won't come back to function again. As a result, you will going to see subsequent deficits with this exposure to nerve agents. And there is some milder versions that chemists or laboratory personnel created it to test this molecule in rodents to develop some therapeutic agents. So in our lab, what do? I think we create those status epilepticus in rats. Here I show you a slide video. And we also create a status epilepticus in mouse model. So there are various stages. Once you give that drug, so this is where the continuous seizure taking place in the mouse. Once we create the status epilepticus in these rodents, then we will give our drug molecule. Of course, we design an experiment, how much dose should be given, how frequent we should be given. And then we look at various things in the brain. I just can't give you enough details today. It's so much molecular biology there. We take the brains out and see what's going on in them, whether there is an inflammation or whether there's a neuronal death, whether there is an called blood-brain barrier, whether it is broken down, or whether there is a synapse loss, or whether there is an acetylcholine esterase activities restored, things like that. But here is one piece of data on the left. See, treatment of the drug TG60-1 substantially improved the percent survival of these animals. These animals, they're going to die in 4 days from the status epilepticus. So that's one big problem. I think we have a molecule right now. We are currently instituted a small biotech company. One of these molecules for all the way up to the patients, but as I was showing, there are hurdles obviously everywhere during the clinical trial. So we are right at the junction of the pre-IND stage or IND enabling studies area. So that one problem I have shown you, status epilepticus. The second problem we are trying to address is the Alzheimer's disease. If some of you are seeing this image here, this is how our normal brain look like. All of us, I think, listening today, our brain is like this. Some point of our life, I'm not sure when, if we live really long enough, more than our average livable life, depending on our country where we are living, but sometime we might reach to this mild cognitive impairment stage. And then if you have Alzheimer's, if you have Alzheimer's disease, then this is how the brain looks like. Basically, you lost a lot of neurons, tissue, cells. As a result, the brain will be, atrophy, what we call, the brain will be smaller than the regular brain. if it comes to Alzheimer's disease, it's characterized with this buildup of extracellular amyloid plaques somewhere in here, and then intracellular neurofibrillary tangles. This is inside the neurons. You'll have all these tangles, the tau tangles, close to the microtubules I was showing you in my talk today. Because of this builds up in this brain, you will have the disruption of this, neuronal signal processes of memory. As a result, we will see the dementia symptoms. That is the clinical feature of Alzheimer's disease. Dementia obviously comes in various forms, that you lose memory, you have lose the ability to make a judgment, or you lose the actually make a take the help, things like that. And you can see a lot of inflammation going on in the Alzheimer's brain by the time compared to a healthy volunteer. There is a way to detect what's going on in the brain, like PET imaging and all they do. You can see something called microglia, a cell types in the brain, which actually has a homeostatic job. Like, we call it housekeeping job. He's a housekeeper, something like that. The microglia cell line that does this job, highly activated. Because of that, you see a lot of cells lose their ability to, make the neuronal signaling efficient. So our goal was to reduce that. Alzheimer's is really, if you have an Alzheimer's compared to normal aging, you see the dementia symptoms appear much earlier than aging person, and it has been now known that the Alzheimer's disease really kind of starts somewhere early, several decades, if not years, than clinical symptoms are detected. So it's a huge problem. Our goal right now, actually, in fact, we are testing our molecule in animals of Alzheimer's disease right now. Our goal is to mitigate this inflammatory signaling in the brain, so that could benefit improving your memory and cognitive deficits. In fact, we published a nice paper a year ago, in fact, with my undergrad student, Zara, in my laboratory, when I asked her to just get some of these Alzheimer's mice going on and take their brains out and see what are the inflammatory markers going on. If some of you, this is too much, these are all inflammatory mediators that will induced, and we can see whether we can decrease those by treating with a drug. In fact, we have pretty good evidence by now. We are working on a big manuscript to publish in a good journal right now. But that is what we are actually trying to develop medicines for neurodegenerative disease, currently focusing on the status epilepticus. Status I was telling you that it develops epilepsy as well, and many epilepsy patients develop status epilepticus. So as a result, we are going to treat both of those diseases and as well as Alzheimer's disease. So I think with that, because of so many mentors, in fact, during my journey, including Professor David Kupadano, and then Dr. Ashok and Professor Vittal. In fact, Professor Ram Subbareddy, who was actually the one taught us when I was in Saifabad College, how this acetylcholinesterase work. What is acetylcholinesterase? Because we had just had a course at the time, drug design or drug discovery in Osmania University. I hope that it is continually going on. I really record gratitude to Professor Ram Subbareddy. Obviously, Professor Sriman Narayana. He was not my guide, but we used to share lab with him, Professor David, and then Sriman Narayana sir used to share the lab. And I like to also thank Professor P.S.N. Reddy. He was also a mentor, in various ways. So because of these mentors only, I was able to do all this. With that, I would be happy to take any of your questions. and I leave one or two small questions for students to think about going forward in their career.
Thank you, Dr. Ganesh. This is a very great presentation, and pretty much I was completely involved. I did my organic chemistry, but that's ended with my master's. But when you are explaining, it was really great, and I almost got goosebumps when you came to neuroscience part of it. The presentation, the way how you expressed, it's linked to what you studied in your master's, and what are the challenges that you encountered as you are going through your stages of education, the synthesis part of it, and your passion, your energy, the enthusiasm that you had to put everything together. And also you gave really good overview of neuroscience. And Alzheimer's and dementia is one of the leading causes right now that so many people are suffering as they grow older, and it's a huge unmet need in that area of neuroscience. So this is like a wonderful presentation, and I hope it really energizes so many students and also professionals, because we are all, even though we are working, our interest lies somewhere else, and my interest is in neuroscience. This is kind of like a really very good presentation. Thank you so much. On behalf of me, and also I'm sure everybody enjoyed today's presentation. Thank you. It's a great pleasure to have you here today. So with that, I would like to open the floor for if anybody has any questions. Please feel free to speak up, unmute your mic and speak up, and also you can enter your questions in the chat box. Go ahead, anyone.
Madhavi, may I? May I ask a question?
Sure, of course, please.
All right, thanks. Thank you.
Hello, audience, please. If you are not speaking, can you please mute your mic? That would be really great help. Thank you so much. Go ahead, Mahendra.
Yeah, Dr. Ganesh, as Madhavi said, amazing journey. I mean, from where you started and where you ended, and how you traveled through this journey is really inspirational. I would say that. You started as an organic chemist, and then you ended up as a neuroscientist with the chemistry skill sets. I mean, so this is another example that a chemist can transform into any subject, and the opposite is not possible. That's what we need to remember. One thing, this is a very good example, I would say. Amazing journey. There are a few things that I myself inspired and got that, three things you have to have is, number one is passion towards the subject. Number two is patience to deal with the topic or deal with the problem, and perseverance to overcome the issue or the problem that you're dealing with. So persistently, you have to patiently and persistently, you have to solve the problem. So that the best example is one of the that you mentioned, the slow addition of the catalysis gave you, like, even though your advisor told you that this is not going to work, don't do it, but you know it, and you pay slowly, and I mean, carefully you solve the problem. That's another thing to learn today. There are a couple of questions I have, something related to the subject. Other than that, but again, I said, as a alumni, this is a very good example of learning how to build your career to all the students and scholars that I would like to say. So when it comes to the subject, you showed in the beginning this globe type of molecule. They're called fullerenes, right? I believe I'm not wrong. Right. So exactly right. In 90s and 2000s, it's difficult to draw. And still, I believe, difficult to synthesize or make those molecules. You have to have special techniques. There are different things are there, right? That, I mean, it reminded my coursework. So that just I'm highlighting that thing. The second question is, so I'm always interested in behind the scene ideas. Like somebody says, I did this and then this it didn't work, and then I tried that. But I always think, what made you to think to try for example, your slow addition of catalyst. Now, what made you to think at the time? Like, and you are thinking different from the others, right? Why? There should be some kind of a motivation for that. That's the one question, so that people can learn how to think differently, how to solve the problem differently. So I would like to hear your thoughts on that thing. And second one is your Alzheimer's project. That's another, again, amazing project. You're doing, it seems you're doing a lot of high throughput screening of molecules to find the skeleton and then build based upon the scaffold, to build different novel molecules based upon that scaffold that you find in the high throughput screening. I mean, this is what is the novelty in the organic chemistry or the chemistry. Back in the days, structure-based drug design, randomly it used to be done, right? Lipinski rules and things. You used to think about Lipinski rules and all these things, right? But now the science is so much advanced that you can do the high throughput screening and you can find the right molecule, and then based upon that, you can, again, still you can use the Lipinski rules, but you can build it upon the much more potential scaffold, right? Is there any mechanistic details that you started with? Like, for example, there's a mechanism, for example, protein-protein interactions, and then you find one protein and you design based upon that scaffold. But for you, I couldn't follow much that, where you started. Like you spoke about the amyloid plaques, microglia, but where was the mechanism? Where are you targeting your molecules? That's my second question. Thank you so much for your wonderful presentation.
Thank you for your remarks. Actually, I'll start with the last one first. So using the gene knockout animals with this particular receptor known as EP2, prostanoid receptor, using the gene knockout animals with particular receptor EP2, it's been published or touted from our own lab as well as from others. We published that this receptor really playing a very inflammatory role and exacerbate the Alzheimer's disease as well as few other neurodegenerative diseases. So that was one piece of evidence. So we have not yet used the structural images or structural information to design the molecule. So we initially wanted to discover few molecules that target this receptor. So based on this receptor, I should have shown one more slide actually that would have helped you. So what does this do? This receptor, if you activate it, it produces cyclic AMP in the cell. That promotes the inflammatory signaling. So we wanted a molecule, something inhibitor. So that's how we designed an assay, adopted into high throughput. That's how we came up with and settled on this particular receptor. So, and then we are trying to test the pharmacological approach. So that's how target selection has taken place. So far, we haven't used any structural information like molecular modeling or anything to design the molecule. As you were saying, we definitely used the Lipinski's rule of 5, and then few other rules now that coming into picture. There is something called MPO, multi-parameter optimization, coined by Travis Wager. He designed some rules how a molecule can get into the brain. So some of those, we built that to develop these molecules, to come up with, we have at least half a dozen molecules. I haven't shown you because of various reasons, proprietary reasons. I just showed you some research molecule right now that published already. But that's all. The second one, the idea that I thought the reaction ring closing metathesis work here, the previous students, in fact, they were simply adding the Grubbs catalyst and then cooking this reaction. Basically, synthesis is nothing but cooking. How you cook is different, makes a difference, how you end up in the taste. So Grubbs catalyst was discovered for polymerization of olefins at the beginning, not for making organic molecules that all ended up making. So when people were making this, two my predecessor, when they mix it together, basically I thought that this is going to a polymerization and end up in junk. So I set it up a syringe pump to add that 5 milligrams of catalyst entire overnight, rather than rather than really, adding in a minute or, at lump sum. So as a result, you're only giving a catalyst necessary to make few molecules into ring closing to give an expected result. So that's what my intuition was. In fact, it worked for several molecules, not only this scaffold, but many others. When I was in Professor Kota's lab, we really was very, very cautious about this nitty-bitty things, very tiny things. So that's how it helped. When it comes to this caged size molecules, these were close to fullerene type of molecule. There was a fascination that someday this molecule can be used as a carrier for drug molecule to the site of your interest. That one of the major goal at the time was. Although they look like cage, so any small molecule, drug-like molecule can get into there, and then this could act as a carrier molecule. So as a result, so much fascination. In fact, here was very small change compared to a McCarvey. A guy named McCarvey was trying to synthesize this molecule from this C20 hexaquinone. He's slightly away from us, whereas our ketone, this is Kota's lab approach, our was small difference. So he started with this dione, we started with this dione. So these are all kind of making us to think, okay, you make this small maneuver, you're going to get there. That's what motivated us to really develop methodologies.
Great. Just a quick comment. No, sorry, Madhvi. Just a quick comment. One based upon the responses from Dr. Ganesh. So you're talking about the drug delivery or drug carrier of these fullerenes, right? So I mean it's like a lot of people have been trying since a long time on this thing. My question is, I mean, these are all the carbon structural builds, right? Basically, so okay, I mean, we can encapsulate. I mean, in inorganic chemistry also there is a cage molecules, there are metal organic frameworks, there are so many of them. Similar type of molecules are being developed. Have you ever thought of gas storage? Or I mean, now, I mean, of course, you're a medicinal chemist. You usually think about the drug delivery at that part. This is gas storage or liquid separation, or what is called impurity separation, like from various water or even in the crude oil processing plants or things like. Have you ever thought of that in that kind of sense? That's one question. The second one, you mentioned that the slow addition, because I asked that question because I used to use the same technique. I used to make cyclic compounds using the two molecules bringing together. Same technique. People like when you crowd the molecules, and then they're going to get confused and they're going to tangle around, and then various different molecules are going to form. But if you do the slow addition and then dilution method, then you achieve a much more selective reaction. That's why I asked. The third one is the PP2 receptor seems to be it's a kinase inhibitor, right? Have you ever thought about thinking about the kinase inhibitors? There are some kinase inhibitors already there. To use them as a scaffold, or maybe you may get started from those molecules in the beginning. Probably. Have you screened selectively the kinase inhibitors? These are the 3 points that I would like to highlight.
Yeah.
Thank you.
So thank you. Yeah. So the first one, you're very right. These cage type of molecules can be used as a as like a purifiers. If you really clog them into a nice cartridge, and if you want to have a filtration of your water molecule, definitely they could clean the junk out. It's one application. We haven't pursued it, but certainly worth pursuing it in that direction. The second one, that high dilution technique, I showed it to you. It not only works for simply a Grubbs metathesis, it could work for various other techniques. For example, when I was synthesizing this ipathalone, where was this? Yeah, ipathalone synthesis. There is a fun final step we had to make. This is called macrolactonization. All we simply was using triphenyl phosphine, and then there was a dead diethyl azo dicarboxylate, and there was a triethylamine catalyst. So how we deliver that catalyst will determine whether you get the expected product or you don't get the product. So that technique really works. So that's how we had some experience using that in multiple occasions. The third one you asked, that kinase inhibitor screening, we have not done in our laboratory, but I do see that few others are focusing, going after kinase inhibitors to derive some medicines in the CNS area as well.
Thank you.
Dr. Padmashri, I see your hand raised. Please go ahead with your question.
Yeah, thank you, Madhu. Yeah, thank you so much, Dr. Ganesh. Very inspiring lecture. Actually, I couldn't stop myself complimenting you. I've seen you mentioning that you had, corrected your own paper, and very honestly, you've mentioned it and you've done that. I really like that. And first thing is, you have put Professor David Sir's picture on your first slide, to see my own teacher there, and your, remembering your mentors there. One small,
Padmashri, your voice is really breaking a lot.
What Mahendra was saying.
Padmashri?
If there is a connection problem, network issue.
Am I audible now?
Now is better, madam. Now is much better.
Can you hear me? Can you hear me?
We can.
Yes.
Yeah.
You can speak now, Padmashri. Let's see. Yeah. Go ahead.
I think she logged out.
Yeah.
She'll rejoin.
Yeah.
Hello, sir. Surya Prakash, sir. I see your hand raised. Please go ahead.
I know, but I thought I will speak only after some student speaks. So if there is anybody from a student side or a scholar side who would like to speak, I'll be happy to speak after them, because I will tell some things about what Dr. Ganesh told, as well as my own experiences with OU vis-a-vis his teachers.
As of now, I don't see, I see your hand raised and Professor Ashok sir hand raised, but I don't see any students.
Well, what happens is that some of us who are speaking every time, they are only speaking. And then I only wonder if people are listening or not. That's the reason why I thought that a student should speak. That's the reason.
I know.
My request to students.
I will tell you a few things. Let me first congratulate Dr. Ganesh, Tota Ganesh. Really spoke well, and you could see that extraordinarily high level of chemistry, particularly the medicinal chemistry, is coming out from your talk. More than that, the passion that you showed, like already Dr. Dhewal as Mahinder, I would be very happy to call him Mahinder. He has told you this word, the passion. That is what has shown exactly from your talk. And always learn, because this learning never stops. Well, with this background, let me tell you, I'll take you back to 1975, 73, 75, when I did my MSc, 71, 73, when I did my BSc in OU Science College. That time, Sriman Narayana sir was our teacher. And many youngsters, including faculty, may not know that well, that Sriman Narayana sir was very, very famous for carrying huge books on his back to classroom and to his lab. His lab was downstairs next to the office of chemistry department, which possibly most of you know. And next to that is his lab, which David Krupadanam sir has inherited. Srivanarayan sir was teaching natural product chemistry, being a trained natural product chemist himself. He was teaching natural product chemistry to us as students. And I don't remember too much of his teaching, but what I do remember is the way of his carrying books. That means that you have to carry your books on your head or on your back to learn something in the first place. So that's something which I can never forget. Then his guide, David Krupadanam, was class first, and he joined Srivanarayan sir for his PhD. He was, I think, 2 years senior to us. And there, even as students, we used to admire David Krupadanam sir's knowledge in organic chemistry. I have known some students from IICT who said that if we had problems with organic chemistry, we will not go to our guides, but we will go to David Krupadanam sir. So they will walk across maybe a kilometer at the best, and then find him in the lab, take him the NMR spectrum, and ask him to interpret, which he will do. So he was very, very student friendly. I think this Dr. Ganesh will tell again and again. Of course, I have known him, David Krupadanam sir, more later part of life as a colleague, and so many times he used to invite, and I invited him too. To Pondicherry and all, but that's a different story. But I really admire David Krupadanam, one as senior, one as a student-friendly person, and everybody loves him. His book on stereochemistry, many of you may know or may not know that his book on stereochemistry is one of those authoritative books which he wrote out of, again, his passion towards science, towards the subject chemistry. Well, then I will take you to, this Sambasiva Rao, Kota Sambasiva Rao, who was my colleague when I was doing associated with Govardhan Mehta, and later faculty member. He also extrudes passion about science and chemistry. I don't know, this man is never, give up kind of attitude he shows. Never give up, never give up. Very recently, just about a week back, believe me, I was interacting with Sambasiva Rao on an issue. About 3 months back, he asked me that a copy of a book in which myself and Professor Mehta contributed an article, Strain in Organic Chemistry. That's a series. And unfortunately, that series is out of print. And this Sambasiva Rao wanted that series entire. So he contacted me. Can you give your book to me? I said, sorry, I can't give you because I donated all my books to the library for Sharda University, where I was working for 2 years after post my superannuation. Oh, then I had to take the book out because I tried all over the world. I couldn't lay hands on. I asked Professor Mehta. He also told I donated. I needed the book. Then when somebody says book, my heart melts. Therefore, I contacted somebody in my colleague or friend in Sharda University, asked them go to the library, take out the book, photocopy it, and send it to Sambasiva Rao Kota, which he received just last week. And then he called me to say, oh, thank you so much. Out of those 5 or something like that, I could get 3 and 2 more are there. Then I said, okay, now you keep trying, you will get it because you will succeed because you never give up. So that's what I think Dr. Ganesh learned from Sambasiva Rao Kota. Whatever you do, you should never give up. That's the attitude. Then I will tell finally whatever I know of Professor David Kingston. David Kingston is generally considered as the father of modern natural product chemistry, not the earlier one. Natural products have been around for such a long time. He was the editor of Journal of Natural Products, an authoritative journal. In many respects, people used to think that that is David Kingston's journal itself, although it's not his journal. So he was controlling that journal a lot. And his story about Taxol is, I think everybody will know, Wall and Wani. Wani is an Indian. Wall and Wani, who discovered Taxol, and David Kingston made it useful to the entire world by modifying Taxol. So that, Taxol, of course, one will not be able to get from the tree trunk all the way. Therefore, one has to find ways to do that. And that's where I think Dr. Ganesh work of arresting the conformation of the molecule into a certain conformation, like T conformation, as you told already, is amazing journey. But I have a question for him, because we also used Grubbs catalyst in our research, and then when we make a larger rings, the stereochemistry is not very clear. In fact, he himself has shown two stereochemistries in his in his slide, the cis and trans. So what determines the stereochemistry of a larger rings? Is it kinetic or thermodynamic? Product is something which is not extremely clear, at least to my knowledge. Maybe Dr. Ganesh can clarify. So this is the question. So at the end of my taking you towards what Dr. Ganesh may not have told because of his humbleness, therefore I try to take you to the journey that he had gone through. Thank you so much. It was a wonderful talk, and thanks for the opportunity to speak.
Thank you, Dr. Suprakash. I'm so happy to hear that your association with Professor Kotha, and I'm very pleased to learn. In fact, I have to start with, I'll be very brief. I have to start with, honestly, I have learned the logic of organic synthesis from Dr. Ashok, Professor Ashok, sir. So that's where I started. I greatly benefited from it, number one. Number two, I so inspired with Professor Srimanarayana. One time, I took a IR spectrum of a natural product. I just isolated from the plant and showed it, sir, I got a product from plant. Hey, this is beta cytosterol. And he used to tell just like that. He was so memory that he has so experienced that he was so great. And one time I remember my thesis or someone else's thesis, we printed everything. Because he is an elder person in our lab, although David sir is my supervisor, we used to share everything. I showed it to him, hey, what is this? In the first page itself, he used to catch the mistakes so quickly. Then we had to print the entire first page of the thesis, go back and get it printed. So we learned so much from them. And also the keenness to first curiosity from David sir and then from Kotha's lab. I definitely benefited from. Thanks for sharing your association with Professor Kotha. We really learned. I was the first postdoc for him. Well, I was an RA, not postdoc. I didn't graduate by then. He was at the bench at the time. He used to sit with us and teach a lot. That's how we learned. As to your question, it is the kinetics first. If you can kinetically bring those olefins, although they are far away from each other, if there is a molecular flexibility for those olefins to come, Grubbs catalysts are pretty sturdy. They could bring those two together to make a bond. But if thermodynamically, if their enthalpy or entropies really won't support it, it's probably difficult. So you really need to have somewhere in the middle to make those olefins to bring this back, to make this olefination took place. At least that's what I can think of right now.
Thank you, Dr. Ganesh. So I have a couple of students who is raising their hands now. So I'll go to Dr. Ashok sir for a bit. Then I'll definitely go to Venkat and Dayanand. If you can give us a few seconds, I'll just wanted to ask Dr. Ashok to speak.
Thank you, Dr. Madhavi. And first of all, I would like to thank the organizers for providing me an opportunity to meet my own students during these webinars. Thank you very much. And Dr. Ganesh, really, I am very much excited. And because I know you since many years before PhD also. And really, your presentation is excellent. And what I saw is it was almost similar to Professor Gordon Mehta's the presentation as far as the molecules concerned. Really, hearty congratulations to you, Dr. Ganesh. And whenever I call Dr. Kotha, we remember you, we discuss about you. And a few years back, I visited Kotha's lab. he has showed all your work preserved in his lab, even now. Really, I'm very happy, and your work is excellent. I'm very proud of you, Dr. Ganesh. I have a small question. We have also carried out ring closing metathesis using Grubbs catalyst. We wanted to do some more work also, but the catalyst is somewhat costly. Are there any alternative catalyst which is somewhat cheaper, can do the same job? Have you come across?
It
Dr.
shouldn't be
Ganesh?
that expensive, sir. Yeah.
Okay, okay.
Sorry. Let me answer you very well, sir. Sir, thank you so much because of your training and all. We are here, number one, and thank you. Thank you. If you have an opportunity to talk to Kota sir as well and talking about me.
Yes.
Thank you all along for your help. But to your question,
Yes.
the Grubbs catalyst, in fact, I remember, sir, at the time when I was in Kota's lab, first we bought from US. At the time, we kind of felt it was a little expensive. Then we had in IIT, we have something called undergraduate research program, which we do have in US too. And we put in a candidate to synthesize grams for us. We can synthesize ourselves. We do not need to buy, number one. Number two, as far as I can see, the first generation catalyst should be not that expensive.
Yes.
We could really, if that is what exactly is a stumbling block for you guys, we'll be happy to arrange some for you from our lab.
Okay.
But as far as synthesis is concerned, it's simply two-step synthesis. You add this ruthenium tetrachloride or something. You add in one step this this molecule, and then you do this. One possibility is that you could synthesize yourself. And it is pretty robust. It is not moisture sensitive. It is not water sensitive. You could do the reaction in water, by the way, with ruthenium catalyst. We did a couple of reactions. So that's one way. The second one is that
one can recover it.
we could find something. Yeah. Sorry, sir, you're on mute if you want to speak something.
No. One can recover it.
We can reuse
it. Yeah. Reuse it. Yeah, exactly.
Yes.
Okay.
Okay. Thank you very much, Dr. Ganesh. Thank you so much.
Thank you, sir. And Venkat, I hope you are still there. I'm sorry. You had to. Please go ahead. Yeah, please go ahead.
I'm still here. Thank you so much, Madhavi. First of all, thank you so much, Dr. Ganesh. It's a wonderful talk, and again, it's an inspirational story for everyone. Definitely, all the scholars will get benefited out of your experience. And my question is around developing this neuro drugs. So it's kind of, I know it's very challenging to develop these molecules. And one of the challenges overcoming, delivering these medicines and overcoming this blood-brain barrier. Is it right? So did you see? Did you face any issues in terms of blood-brain barrier? And how did you overcome those issues for the molecules that you are working on?
Thank you. Yeah. So yeah, if you really want to develop a drug for CNS use, definitely the molecule has to get into the brain. So one of the features during the lead optimization, what we call lead development stage in the medicinal chemistry, we try to see, first obviously start with the lead molecule, get the blood-brain barrier tested first, brain permeability tested. There are several in vitro assays that we could do to see if the molecule permeable across the cell lines, and to see if the molecule is a substrate for efflux pump. Something called brain has a privilege that if someone is entering into brain, it doesn't want to enter it other than food and water are needed. So it pumps out, what that is called efflux pumps. So we wanted to measure a molecule. Is it a substrate for those efflux pump? If it is, what is making in the molecule to be substrate? So we try to structurally modify so that it gets into the brain. Then eventually we end up giving it to animals and see how much you have it in the plasma, how much you have it in the brain. Then you record the ratio. In fact, if you go a little deeper, we also look at the plasma protein binding, brain protein binding, then determine how much is unbound in the brain, how much unbound in the plasma. So we do have an opportunity by looking at the structures. For example, if I have a carboxylic acid, no, it's kind of a, most likely, it's a no-go to develop CNS drug unless that carboxylic acid is a substrate for influx pumps. There are some pumps they would take into the brain. So such molecules will not be able to make it into the brain, carboxylic acid or some high polar molecule. But there are some amines, they are high polar, but they are pumped into the brain because the brain needs them, and it created some pumps for those.
So much.
Thank you.
Yeah. I don't see any more questions. And just as a quick, okay, I see Dayanand. Are you still there?
Yes, madam. Good evening, all. This is a very great opportunity for us to hear great lectures from Mahendra Deval, Madhavi madam, and Ganesh sir. Really, Ganesh sir, your talk is very good and extensive and highly informative, sir. Ganesh, do you remember I am Dayanand? Ganesh used to go to David sir lab in nights also taking torch. And he used to say one thing, in IICTs and IITs, they use more chemicals and more solvents. Whereas in our university labs, we don't waste chemicals. The same thing and the same concept and the attitude is the same while using the, instead of Grubbs catalyst, and he said that 5 ml of a catalyst was used, but not at a time. All through the night it had to flow. The same concept he had explained me 10-15 years back. That's what I remembered, and I want to share this one to all of you. Ganesh, I am Srinivas Sari classmate from Nizam.
I do remember, Dayanand. I do remember. Thank you so much. I do
Thank
remember.
you, Ganesh. Do you remember we used to go to your lab? Thank you so much to see you. Thank you, Ashok sir. Thank you all. Thank you, sir.
Yeah, Dayanand, you're exactly right. You know, the light always on in David sir's lab because of Ganesh sir. I remember that too. The light is nighttime, daytime. The lab was in the first floor or the basement, I guess. In the basement, it used to be always on.
There was secret to it, Mahendra, because during the day we used to have cricket matches to watch it. So when can I work, right? I do not want to waste my time. I used to go early in the morning, maybe 3 o'clock, get a couple of reactions started, watch with my friends, enjoy the cricket match. During the break, go and do the column, things like that. I remember. Thank you, Diana, for bringing that to me. Yeah.
Thank you, Ganesh. Thank you. Thank you, Mahendra sir.
Yeah, you have to enjoy whatever goes at the same time, like which one, right? Sometimes you can't compromise, so you always find alternative ways to do it. So yeah, perfectly done.
Very nice meeting you, Dayanand garu.
Thank you, sir.
Rambabu
Yeah.
sir? Yeah.
Good evening, sir. Ganesh, it is very nice presentation on medicinal chemistry. Sir, just a general question of mine is, as so many scientists are working towards drug discovery, especially for natural product and small molecule synthetic. So, I mean, if in your view, what is the success rate of these drugs, sir? What is the success rate? Why, I mean, especially taking off drug discovery programs, people are little hesitate, especially pharma companies, that too taking off natural product related. So can you just enlighten us in that view?
Certainly, yeah. You are very right. I think success rate is low, I would say. But if a company has really perseverance that they would like to discover a small molecule for particular indication, it is feasible. It could take. There was a slide I showed it to you. It could stretch anywhere from, let's say, if I look at this slide, there are various steps in here. For example, let's say you already know the target, which already people spend 5 to 15 years, and you already know the small molecule. If you know, then it would be little easier. So success rate would be lower, but your efforts will not go in vain, I would say. You will learn a lot during the process. Of course, that's what all scientists have to do. We will learn and publish. But moreover, we will, as a scientist or as a professor, we will not be able to see or take the molecule all the way to the final. Although there are exceptional examples, including my past professor here at Emory, Dennis Liotta, who has taken all the way from a lab to the clinic, is HIV drugs, Emtriva, Emtricabin. But there is it's not really no-go. I mean, you could still take it. If it is natural product driven lead, in fact, you have a more chances of, if the lead is the natural product and if you have an opportunity to synthesize more derivatives, you will have a more chances of success towards than synthetic derivatives. You know what? Why? Natural product is already being selected naturally to pass some of the hurdles that we see in typical modern drug discovery. For example, let's say Taxol and Ipathalone. They already meet the Lipinski's rule in some cases. There are some, and they also, some of these molecules, their solubility is good, potency is good, stability is good, things like that. So you have an opportunity. You have a success rate little higher, I would say. Only difficulty there is that you probably will not be able to synthesize so many molecules if you just start with a complex natural product. But yeah, I see your point. There is a challenge, but you have to take it.
Yeah, may I add a point, Dr. Ganesh, if you don't mind?
Yeah, please.
Yeah, I think, this is in my experience, it's difficult. Yeah, it's not only the discovery part, the drug discovery part. I think it's a delivery and in vitro, in vivo. The success depends on not only the discovery, but also the drug delivery to the targeted delivery, or, and the other thing is biodispersion. Once it goes inside the body, how it is being distributed uniformly. And is it reaching to the target? There are several things. I mean, sometimes, when you do test in the test tube, in vitro studies, right? When you do on the human cells, and maybe sometimes it may work very well, like, toxicity, low toxicity, and very high potency in the in vitro studies. But when it goes to the animals, and that's where the difficulty starts. Like, for example, even, Dr. Ganesh Garu is struggling with is probably the blood-brain barrier. When you're dealing with the brain, the blood-brain barrier is one of the biggest hurdles. These are the many, I think, challenges are there, not only the discovery part. But again, it's been increased from past 25 years because of the technological developments. The success rate is slightly increased, I would say. Not drastically, but slightly increased because of the technological developments, especially like what Dr. Ganesh said, using the natural product scaffolds, natural product mimics, biotherapeutics, lots of different technologies came in, and high throughput screening technologies. So the success rate is increased, but again, there are many challenges are there, not only one discovery challenge.
Mahendra Garu, nowadays we are having so many, modern technologies. But the discovery rate, when you compare with our, professor's time, it is going down. Even importance for the science is going down. When, our professors, David sir or Ashok sir, that time, if you see the chemistry, demand for the chemistry either in the Osman University or in the IICT, even after getting CSR also, okay, getting in the IICT used to be very tough. Now hardly people are going to IICT.
I understand, Rambabu. I can understand. I can address this as well. Ganesh Garu, I'll let you speak first and then I can address.
Yeah.
Go on. May I? Dr.
Yeah,
Ganesh
go
Garu?
ahead. Yeah.
Yeah, go ahead.
Yeah, you said, Rambabu, I understand your concern. So back in the days, the chemist and chemistry was the thing to discover the drugs. At the moment, like I said, biotherapeutics, now antibodies, which are the proteins. Now, the best example, Moderna and Pfizer, mRNA therapeutics, they are nucleic acid therapeutics. But back in the days, nucleotides are synthesized by a chemist as a potential therapeutic molecules. But now, biological molecules came into the place. They are kind of competing because, like, again, it goes back to Dr. Ganesh. Natural molecules, they are naturally inbuilt in the body, right? Can be used them straight into the body. And the success rate is much more potentially higher, I would say, compared to the non-natural molecules, like when you synthesize a molecule in the lab. So that's why now the science is transforming rapidly, I would say. So again, next generation. Let's think about, now we're talking about it's going to be there, therapy, drug discovery, and molecule, what you call, tablets and other things. But gene therapy is going to come in next 10 or 20 years. Gene therapy, gene editing. Imagine yourself. Right now, the personalized medicine, like, you take the person, pharmacogenomics, cancer genomics are there right now. We just take let's say a person has some kind of disease, you take a blood sample from him and design a drug for his own disease, that person's disease. That's where we're heading, personalized medicine towards. And next, I would see, like, next 25 years, gene therapy is going to revolutionize. Cell therapy is going to revolutionize. Now, cell therapy is there for the couple of cancers. We take the cells out of your body, we engineer them, and then put them back in your body, and your disease will be cured. This is the methods are coming. Novel new technologies are coming. Yes, I understand that back in the days, the chemistry was the only thing to discover the drugs, but now biological molecules, the transformation of the science is kind of taking over the chemistry. But still, again, the fundamental science is chemistry. So it has to be there. It's going to be there. When you talk about mRNA, again, it's built on nucleotides. A chemist has to synthesize the nucleotides and then you build it. Again, anything change a chemist can do, but because of the biotherapeutics, probably you don't see a lot of drug discovery and small molecule drug discovery problems. Again, success rate. We're living in a business competition world, right? If the success rate is low in the small molecules and success rate is high in the protein therapeutics, then the world leans towards the protein therapeutics. So that's where we'll go right now. I hope I answered your question.
Nicely put it. Actually, that's olden days, have a biological problem, chemical solutions. Biological problem, chemical solution. That days have been fading away since the discovery of these personalized medicines through gene mutations, RNA therapeutics, identifying particular gene that causes cancer, just find the antibody or, anti that particular target and then go for it. So those things are coming, but still, with the current times, you still have the opportunity for chemical innovation, and then using the techniques that are out there, rapidly progress to clinic. So it's still within the reach of a chemist right now at drug discovery or therapeutic discovery. Maybe a few years from now might change.
Yeah, but this is the reason that I always recommend to the research scholars or campus research scholars, expand your knowledge to other fields as well. Just don't stick with the chemistry only. You need to learn a couple of multiple other set of science subjects too as well. Like Dr. Ganesh Garu, last time he explained that he used to go to the biochemistry department, neighbor department, to see how the bacteria was grown, and then he tried to learn from his friend. This is what you need to do at this moment. Yes, of course, chemists can learn quickly, faster than the other people.
Yeah, that's a very good example of, and also very well said, Mahinder, because it's a chemistry, of course, but there are like, even for the Dr. Ganesh experience, right? Like learning about the modeling, how you can incorporate both of them to go into a next level, those kind of overview approaches, and you have to see it in a holistic way. Whatever you are doing is how it's going to use to in a reality. So that kind of a bridging that you have to develop and innovative solutions. Each person can have a thought process, and just you have to nurture and take it from there. So that's the whole passion and enthusiasm your energy relies. And as we always speak, that you are the driver of your thoughts. That's just sky is the limit. Just go for it. And yeah, everything excellently described, very well presented, Dr. Ganesh, one more time. And due to the time constraint, we might have to end this session, but Dr. Ganesh will be available to take your questions. Please get in touch with him. And also there are other mentors available to answer your questions. Please, scholars and students, make use of this opportunity. And I would like to invite our one of the research scholars to give vote of thanks. I hope the scholar is available now, Dr. Padmashri.
Yeah, Dr. Madhi, one request to Dr. Ganesh. Could you please stop your screen share? I would want to share something.
Sure. Yeah. Okay. Thank you.
No.
Thank you. Is my screen
it's coming
visible?
up? It's coming up.
Dr. Madhi?
It's coming up. We don't see anything yet.
Yeah. We do now.
Yeah. Yes. Yeah, this is like an appreciation from all of us. Dr. Ganesh, for a wonderful presentation.
Thank you very much, Dr. Ganesh.
Thank you all. Thank you all.
Yeah, this is a token of appreciation from us to you.
Thank you so much for inspiring all of us. Yeah. Yeah, I request Mr. Keshavlu, could you please unmute yourself?
Dr. Keshavlu, are you available?
Hello, am I audible? Mr. Keshavlu?
Yeah, you are audible, Mashri, yeah.
Yeah, Mr. Keshavlu, please unmute yourself and give the vote of thanks. Are you there, Mr. Keshavlu? Hello? Keshavlu? I think he was there earlier. Maybe he lost the connection.
Possible.
Yeah. No, I don't see him. He was there earlier. Yeah. I think Madhvi, we will wind up the session. Dr. Ganesh, thank you very much for a very inspiring talk, and we hope we have more such interactions with you for all our students. Yeah, thank you very much. And we'll definitely invite you once again, and hope sometime when you come here to the department personally also, you could please give a talk to our students. We wind up now then?
Yes, thank you, Dr. Ganesh, and thank you everyone for the today's participation and your great questions. And thanks all the mentors, all the students, and one more time, Dr. Ganesh, excellent presentation.
Madhvi is there, I think. Dr. Keshav, you have joined. Would you like to give the vote of thanks?
Yeah, ma'am. Yeah,
On
yeah.
behalf of scholars, yeah, please go on. He lost the connection, I think. Yeah, please carry on.
Yes, miss. Yes, good evening to all. This is a wonderful opportunity to share my gratitude towards the Ganesh sir, right? So I take this opportunity to thank respected Dr. Tota Ganesh sir Garu, so for sharing his personal and professional experiences and his journey from Osmania University to Emory University, right? So it is a wonderful journey. So very inspiring, sir, with your journey. So we will try to learn so more and more from your journey, so, and we will get benefited in our future, so to get success, right? So and it's my pleasure to thank Department of Chemistry conducting for such a informative and successful program, step up mentoring program. So it was the 9th one. So let's so many programs we'll see in our future that will be helping to get success. So I extend my gratitude to thank, so especially for Haripandasri madam. So her motivation towards the joining or interacting with so many new people, so whoever are in the mentoring program, right? So and I extend my pleasure to the whoever the backbone of this mentoring program for conducting such a programs. So let me interactions, right? So at initial stage, we are so fear to interact with many mentors, whoever are in the alumni, right? So as going on, so as we are entering so into the so many lectures, right? We will try to overcome the fear and will interact with you people. So with the help of that only, so little bit, not instantly, little bit will grown up in our future, right? So I also thanks to research scholars who are attending this program. You will be benefited with the help of these wonderful lectures, right? So thank you for giving this opportunity to me, ma'am.
Thank you, Kesholu.
Kesholu.
Yeah.
Thank you all.
Okay. With that, I think we can close the session and enjoy your evening in India and have a wonderful weekend in US. Thank you all. Bye.
Bye, everyone. Bye.
Yeah, happy weekend to all. I'm ending up the session, please. Thank you.
Yes, please. Yeah.